All right. Welcome, everybody. Thank you for taking the time to be with us today. We appreciate you being here for another one of our monthly webinars for DFibTech. My name is Mike Papali. I'm the manager of community relations for DFibTech. DFibTech is a AED manufacturer. We're based in Connecticut, but we have our AEDs all over the world. So as I'm sure you know, if you've been to any of our other webinars, we are really into our mission, and that is to increase survival from sudden cardiac arrest. And with October being Sudden Cardiac Arrest Awareness Month, we thought it would be great for you all to hear some inspiring stories from some people that have been personally affected by sudden cardiac arrest. So if you have any questions as we go, feel free to put them in the Q&A. And I just want to thank, we have Kai Bates Diop and Julieta Valdez. Thank you both for being here with us today.
Thank you for having us.
Yeah.
Thank you for having us. Looking forward to it.
Yeah. So you all both have incredible stories, and we are going to get into those pretty soon. But before we do that, I just think for everybody watching, it'd be beneficial to kind of get some background on each of you kind of growing up before you experience your sudden cardiac arrest. So, Kai, I'll start with you. Could you kind of just give us some background on kind of what your life was like pre cardiac arrest?
Absolutely. Yeah. So basketball was my main sport, kind of main sport I played kind of growing up. Up to this point, I was pretty serious on playing basketball. After high school, I played for a really good AAU program based out of Chicago suburbs, and my high school wasn't too bad either. And so once I got to high school, I was really focused and had a lot of different trainings going on, and was really committed to the craft and just trying to learn and get better. But also, education was also very much emphasized in my family, so I had a good balance between school and basketball. And during my sophomore year, I was starting to get recruited to some schools. I was on this path where it looked like I was, going to start rising up and keep getting better and better. But number one lesson in life, you just don't know what you're going to get. So my sophomore year, during our practice, it was kind of just like a beginning of the practice. We were warming up, doing some pretty routine drills. I remember coming out of one of the rotations and felt my heart beating harder than I really had ever felt before. Said to one of my teammates, my heart hurts. And in that moment, I collapsed, going to cardiac arrest. Didn't have a pulse for about 4 minutes, and uh, I can't overstate how grateful and appreciative I am of the athletic trainers that we had that day for as grad students, and Emily Martz and Maddie Beal. So they really were trained well, and they performed even better on this day. And one of my teammates ran and got them out of their office, and they started administering CPR. Then I responded to the first AED shock. So I remember waking up on the gym floor just very dazed and confused, obviously, because as soon as I said, my heart hurts, I had no recollection of anything what was going on at that point. And so I remember being transported to a hospital in town that day, and then I was airlifted through helicopter to a nearby hospital in Peoria. And so there I spent a week doing my rehab, and that was when I learned I had hypertrophic cardiomyopathy. I went through sudden cardiac arrest. I was really lucky; like only 5% of people or something survive sudden cardiac arrest. At this point, I'm 16 years old, so there's just a lot that was going on internally, mentally, physically, and I had a quick kind of realization in that hospital because I'm in the pediatric unit, so I'm around kids that are much younger than me. But I was able to see that there were some 3 and 4 year olds that really hadn't left the hospital yet because there were so many complications with their birth and life up to that point. So I had a lot to be grateful for. I still do have a lot to be grateful for because I essentially had 16 years that were uninterrupted with any like or without any real life pause or circumstance that kind of made me reevaluate kind of everything up to that point. So in my recovery from from that cardiac arrest, reached out to a sports psychologist, and that helped me out a lot just on my journey of being able to look at things differently. But I'll save that for the rest of the
Yeah.
webinar. But yeah.
Awesome. Awesome. Wow. All right, Julieta.
So I actually have my story mirrors Kai's very closely. I was also an athlete for all of my life, for as far as I can recall. I played volleyball, in particular, and I got to be pretty good at it. At some point, I was ranked number 18th in the nation, and I was getting recruited, and it was my whole entire life. I devoted everything to the sport. So in my head, I believed that I was going to go and play all the way up to college, maybe even after that, and I mean, nothing really stood in that path for me, except whenever I went into cardiac arrest my freshman year of high school, during the pandemic.
Yeah. So yeah, go ahead. Tell us about tell us a little bit about that day. I know you were with your sister, but yeah, tell us some details about that day and kind of how everything happened.
Yeah, of course. So, it was right during the pandemic, so everything was shut down, and my sister and I really wanted to stay active during the time of the lockdown, since in my head I was believing that I was going to return back to play volleyball. So I wanted to stay in shape and I wanted to remain fit. So that day in particular, I had already ran like 3 miles. I had already done my volleyball workout that they assigned us like virtually. And it was around 11 p.m. at night, like 10:30 or 11 p.m. on a Sunday. And my sister asked me if I wanted to work out with her after she got done with her online classes at the University of Texas. So I said yes instead of going to bed. And I started doing push ups with her, but I'm particularly bad at push ups. So I was doing push ups facing her, and I told her that I wasn't feeling too well. And about 30 seconds after I voiced that concern to her, that's whenever I knelt up, said, "Oh God," and collapsed. And she originally thought that I was having a seizure, but it wasn't until she called my mom upstairs that she noticed that I wasn't breathing. I was trying to gasp for air, but nothing was really being pulled in. So my mom initiated some makeshift CPR while Patty, my sister, called 911. And they traded back and forth until the first policeman came in and took over CPR around 6 minutes later. And then that's when paramedics and firefighters came, and they weren't able to get a pulse on me until around, we estimate, like 30 minutes after my moment of collapse. So I had 4 shocks from an AD, the injections of adrenaline, all that. And I got taken to 2 different hospitals that night as well. Um, and to kind of glaze over my whole hospital stay, since it was quite an extensive one, I just had ECMO. So I was put on life support and a medically induced coma for about a week. And after that, I had my ICD placed, which I'm very grateful for. And I was also in the pediatric ICU unit. So I definitely had the same feelings that you also shared, Kai. But after that, I was able to pretty much recover really smoothly due to the fact that I was an athlete. But the mental aspect definitely was an ongoing process and still is, really. So yeah.
Definitely. Cool. All right. So Kai, when you kind of first, I'm always curious about this because I feel like you, you have a heart disease, but you don't know about it until like this happens. And like what was that like kind of just like finding everything out and like hearing that you had a heart disease that you had been living with? Because I think still like when we're kids, we think we're invincible, and we also don't think like we still don't really associate heart disease with young people, I should say. So kind of just talk through kind of when a doctor or somebody came in and explained everything that had just happened, kind of what was going through your head.
Yeah, it was a lot, and some days I still feel the overwhelming, like wow, like that really happened, like that was a moment in my life. But yeah, just sitting in that hospital bed, it really helped to have my family there. I had both my parents and my brother there. That definitely helped for like the social support of it all. But just hearing that, to be honest, like there was a little bit of like this, like learning that I wouldn't be able to like play basketball. And this is sometimes something that happens, in injured athletes. 'Cause at this point, I had to, medically retired as an injured athlete. There was like a shred of like relief because I was under a lot of pressure to, conform to these different standards and live up to expectations. Because my brother at this point was like the Big Ten Player of the Year, and he plays on the Suns now. So there was a little bit of relief, like okay, I won't have to like live up to anyone's expectations but my own. But that quickly went away once I realized like that doesn't mean it's going to be any easier. At this point, I'm 16 years old. I just got an ICD, or they're preparing to put an ICD in me as well. And so my mind at this point is focused on like who's my homecoming date and those types of things. So it really was a lot of introspection that was done, a lot of like, wow, okay, those people that told me, play this game like it's your last or practice like it's your last, like they said that for a reason. They weren't just saying that to, take up space. Like they were saying that because there's an underlying kind of philosophy of like truly live every day like it's your last, because you really don't know like when that date's gonna come. So really I just grew a lot, I felt like I was a fairly thoughtful person before then, but became even more thoughtful and more intentional about like how to live my days the best that I can. But it was a lot, it's hard to describe like just that feeling of being told that at the age of 16, when, you're at this time, you're one of the best players in the state, you're getting recruited to play at Big Ten universities, your family has history in basketball. My dad playing at Creighton, my brother at Ohio State. Like it was just a lot to like. I kind of felt like I was missing out on some things, but then I was able to build on that and find myself in a position to where I end up, becoming part of Butler University's men's basketball team as a manager and then a grad assistant, which really helped me still kind of tap into that capability that I feel like I still had basketball wise, and that was a great experience. But yeah, overall, just a lot of emotions in that first moment.
Yeah. Yeah. And Julietta, you were in a similar situation too, right? Because your doctor told you that, your future in volleyball at that point was over. Can you kind of talk through those feelings and what that was like for you?
Yeah, so I think for me, like I was very overwhelmed because from the aspect of my family, even though we were a big sports family as well, and my brother had played basketball in university, my sister had also played volleyball throughout her entire high school years, and I was supposed to follow. Even though we were very passionate and adamant about sports, I feel like my family kind of overlooked that, and they were just grateful that I was alive, and that was it. That was like period, point blank. But for me, I felt like I was missing a really big piece of almost like myself. Like that's what I had done all the way up to this point. So then not being able to do that for me was very much like a deal breaker. Whereas to my family, it was like, it's fine. It's just an after fact. Like I'm just glad that she's alive. So I think I definitely took it very harshly,
Mhm.
especially because all my relationships, all my friendships, everything was based on volleyball and the different teams that I was part of and all that stuff. So after losing volleyball sport, I also lost like my friends and connections and my pastimes and all that stuff. So I think it just kind of left me almost like out to dry. I didn't know what to do with myself. But I would say the biggest like thing that eventually helped me was to like just try to find different things to do and occupy my time that volleyball once took. Um, but yeah, it was just a lot of emotions and feelings of despair and being like, why me? Why out of everybody else? Like, why did this bizarre thing happen to me? And then I learned that cardiac arrest is actually pretty common in student athletes. But at that time, I just felt very like I had the worst luck ever, and I didn't know what to do about it. But yeah.
Yeah. Cool. So I want to talk about recovery because I think it's a really important piece to, sudden cardiac arrest survival. And the American Heart Association actually a few years ago added recovery into the chain of survival to acknowledge that. So I want to start from like a physical standpoint. And I know you both mentioned ICDs. So you kind of talk about the experience of finding out you're getting an ICD, getting it, and kind of what your experience living with it has been like. And Kai, we can start with you.
Yeah, so getting the ICD was very interesting because at this point, this is like the first time I've ever been injured. Like I had rolled my ankle here and there, but this is like my first like injury. So to have something implanted in you, right below the skin, right above the muscle. It was strange. Like I remember those first couple of days, it was really like difficult to kind of lift my arm up fully and like wear a backpack like all the way around. And I was at school like the next week, so that was interesting to navigate. But I was instructed to, take it easy, basically decondition myself kind of like over the next few months to a year. And then as my like visits to the cardiologist I had at the time, stayed consistent. They were saying that my heart started to reduce its swelling because I essentially like hypertrophic cardiomyopathy is very thick, like a very thick heart, and so blood wasn't able to pump in and out of my heart into my brain, and vice versa. So, because I started deconditioning myself, and that was hard too, because I had been used to just staying on a very rigorous like exercise schedule. So I had to really like be conscious and do a lot of like self-talk and just connecting with other people about like reducing that workload. But eventually, my heart did reduce the swelling, and I kind of got the go ahead to kind of get back to some basic workout stuff. Just like hit stuff and stationary biking. And that's when I realized like how much I love to exercise in general. Like I definitely had this identity of being a basketball player. And I still, was focused on more than that because, as I said earlier, like academics was always preached in my family, and people in my family went to college and all that. But it still was a big identity for me to be a basketball player. But then I realized that exercise also was going to kind of produce some good feelings for me, which was great because I think that helped out. Like once I got over, I should say got over, but once I was able to mitigate and kind of grapple with like, okay, it's okay for my heart rate to get up a little bit. Like I'm not going super hard right now. And just getting more and more comfortable with my heart rate beating a little bit faster than when I'm not doing anything. That was huge in my recovery. Just being able to like listen to what the doctors and say and trust what they had told me. So yeah.
Cool. Yeah, Julietta.
I feel like for me, my recovery was a little bit more extensive just because of the surgeries that I had while I was in the hospital. So for me, my sternum was obviously split, to
Hmm.
put it in easy terms. And I didn't really know what was going on as far as whenever I got my ICD implanted because I had just come out of my coma and 2 days later I had it. So I was still under heavy sedation, and I don't really remember to this day kind of how the timeline of events happened. So my ICD was under the muscle, which I'm very thankful for now, but in the moment it paired alongside the other open heart surgeries that I had and pancreatitis and all these other complications at the moment, it was a lot. So I wouldn't say that I recovered really, really quickly. I think it took for me to be able to walk on my own and sit up on my own probably around like 2 to 3 months. So I think physically it took a while. Also, because I had to switch medications over and over again throughout the following year, 2 years. So physical activity was a big no since they couldn't really regulate my heart after I got home from the hospital. But now, being almost 4 years out, um, I think like at least weightlifting is something that I enjoy a lot, and being able to again like know how much I'm pushing myself and still stay physically active has been a very big part of my recovery, at least physically. Um, but yeah, no, I would say it definitely took a lot more time than what I expected. And it was a lot more extensive than any other injury that I had had up to that point. It was no like rolled
Hmm.
ankle or anything
Hmm.
like that. So it was definitely, I think, more so than physically tolling. I think for me, the mental aspect played a huge piece into it as well.
Yeah. And this is my fault. I should have explained this before, but an ICD, just for people watching, is an implantable cardioverter defibrillator. And essentially what it does is it is a device, and it's basically like an AED, much smaller in somebody's body. So somebody that, qualifies for one or is high risk of sudden cardiac arrest, they implant them, and they're there to save, a person's life if they're doing something and they have an arrhythmia. And what's great about them, I think, is that, it does allow you to do those things, and kind of and have a safety net. And I think that's huge, obviously, for obvious reasons, but also for you psychologically to be able to go exercise, to do things you love to do, and know that you do have this device, so it's there to help save your life. But I want to talk now. Let's talk emotional recovery, because obviously that's a big piece of it. You've kind of gone from, you've had something that you love taken away from you. You've survived a life of that situation, which for young people isn't normal. That's not something that we're like supposed to go through. So Kai, I know you mentioned, working with a sports psychologist, and can you kind of talk through kind of the emotional recovery, and also I think that's, maybe talk to how doing that helped you, because I think that's a really important thing for people to understand, because I think that's a great step to take to try to kind of move forward with your life after something like this happens.
Absolutely. Yeah. So I was a sophomore in high school when I went into cardiac arrest, and then the rest of that year was honestly just very confusing. I didn't really know like what to think, how to appraise the situation, how to really interpret it. I knew like I was grateful to be alive, like that was like the underlying thing, but just going back to school was a very interesting experience. And then junior year was kind of when it started to set in, and I just became, just very upset, very much like woe is me, like why this have to happen to me. I would watch our high school basketball team practices, and I had thoughts of like, like how come I'm on the sideline right now? And just it's really hard days. I think someone explained it as like if your stress is a ball in a box, some days that ball is bouncing all over the place in that box, and some days the ball is very still. And so I was going through a lot of days where that ball was just bouncing all over the place. And so it just came to a certain point where I was like, I think I need to, talk to somebody that could somewhat understand what's going on. And I got hooked up with this sports psychologist that was at Ohio State at the time. And just the way that he was able to conversate with me, or I should say, converse with me about what I had experienced and kind of put it into terms that were very understandable for me. And just really the way that the sessions were conducted, and this was over FaceTime, so it was very like informal. I didn't feel like it was very formal, like uh, step by step type of thing. I think he had his own experiences that helped me kind of just contextualize what had happened to me. So that was huge, and so in that moment, I kind of gave myself some hope of like, okay, if I can help somebody else out, 10 years down the road or whatever, that's going through something as similar as seemingly catastrophic, like that would be pretty cool. So talking to him helped me like really give me something to look forward to, honestly, because in that moment, like I knew I was like gonna graduate high school and like have a life, but I just needed a little bit more like direction, like this is what your life could look like. But emotionally, it's just that it was kind of two-sided for me. Like I went through a near-death experience at the age of 16, to where I just like that, every sense, every shred of control was, gone. And it was also, now you had this athlete, or you had this athlete identity, and now that's not a part of you anymore. So there was two like sides of trauma that I was dealing with, that contributed a lot of just some emotional distress and confusion for me. Um, and I really had an amazing support system just between my parents and my brother, and my friends that like didn't look at me any differently after this. Like that was major. And I think some lifelong friendships kind of formed from my sophomore years, junior years of high school. But yeah, emotionally, being able to experience something like that, to where you have no control over what's happening to you, it kind of changes you, I would say. It made me truly more appreciative. And every day, like I can like say this with 100% honesty, like I wake up every day like with an excitement and desire to, like put my name on this day and be proud of it, because I know that in the future, someday, somehow, like I'll return to this moment where I won't have any control. So in the meantime, like I might as well do everything that I possibly can to fulfill like these days I have. So that's kind of where I'm at emotionally right now. Like I definitely still have days where it's just very tough, and it's more so about the fact that it was a near death experience. It's becoming less and less about the athletic identity, because
Mhm.
I'm starting to see that that's benefiting me a lot. It's crazy like that what I went through is benefiting me in my sports psychology, profession right now. I'm very early into that, just being my first year in my grad program for sports psychology. But the things I lived and experienced like will really help me help athletes down the future.
That's amazing. Yeah, Julietta.
I would say for me, I was also around um 15, 16 years old whenever I had my cardiac arrest. So I definitely didn't know what was going on in the moment. And obviously, sports was a very sensitive point for me. But I think what really made my mental recovery a lot more difficult was seeing how it impacted my family and those around me, particularly my sister and my mom, who were the ones that were
Mhm.
doing CPR on me, had to watch everything. My mom was the only one allowed in the hospital room with me. So she was taking care of me the entire time for the month-long stay that I was there. And so after coming out of the hospital, I was set up with a psychologist that specializes in pediatric cardiology, and she was absolutely wonderful. And she helped us kind of mediate what life was going to be like returning home. So my mom at first would not let me out of her eyesight. She was just, everybody was very stressed. And I felt like I couldn't really have any room to breathe, which understandably so, since I had pretty
Mhm.
much shocked everybody. But kind of going through a process and having someone to help us through those steps and growing and being okay to try to return back to life as normal as possible was, I think, critical for all of us. And still to this day, I know my sister was diagnosed with PTSD. My mom was also diagnosed with PTSD. And so to this day, we still continue to kind of navigate life with talking to therapists and stuff like that to just make sure that everything is going all right and that we continue to heal and move on and all that stuff. So I think for me at least, I had never seen a therapist or a psychologist before, but I think it was critical after the fact to not try to like bundle it up and deal with it all on my own. Um, but yeah, no, I would say it was more so after the fact and everything that happened after my cardiac arrest that made it much more difficult rather than my cardiac arrest itself. So dealing with how my life was going to be different and having to move away and not having friends. And it was during the pandemic, which also added some stress to it. But I would say coming to terms with that and kind of having the mentality of like everything happens for a reason. I think in hindsight helped me now because now I'm a freshman in college and my life is so much more different than what I could have imagined. But truly, I don't think I would be as happy or where I'm at right now if it wasn't because my cardiac arrest deviated me so much from the path that I was going on. So I think having that hindsight now is definitely helping me like come to terms with it a lot better.
Yeah, definitely. And you touched on this a little bit, and Kai, I want to hear your thoughts on this because Julia, you just kind of talked about, kind of led into my next question, but that was the impact that this whole thing has on your family. So Kai, I'd be kind of curious to hear, you're at basketball practice and somebody calls home and talks to your parents, and your parents get this phone call that, that no parent wants or should ever get, that something happened to their kid. Can you kind of just talk about the impact that this had on your family, and kind of how, they handled the whole thing?
Yeah, it was crazy because my dad was at work at the time, and then so he was working at State Farm, and my mom was on the way back from visiting my brother in Columbus, Ohio. So she was like maybe an hour down on like a
Mm.
5-hour road trip. So I cannot imagine what that car ride back was like
Wow.
for her. I mean, just to be in a car, you know, getting this, call that, as you put it, no parent wants to get, and she had to just keep driving. So I mean, we definitely talk about it. Like, my me and my family were very close before this happened, but now like we're very very close. Um, I think just sometimes with the way my mom looks at me, or like we'll say certain things, and same thing with my dad. Like it's just a lot of appreciation, and that was a hard thing that we all went through as a family. Like that was uncharted territory for all of us. My brother, he did something that is hard to even like explain, but I was wearing number 13 at the time, and so he decided to wear number 31 when he was on the Timberwolves and the Spurs, kind of like the inverse of 13, because he really didn't, because his basketball training schedule was so immersive and so rigorous. He really, I think he maybe saw me play a true game like one time, because it's 5 years between us. So
Mm-hmm.
when he was in college, I was still like, I think I was just starting high school. And so and when he was playing high school, like I was in middle school, and our times kind of were just stacked up against each other. Um, So that symbol and that way to honor like, you know, my career in basketball at that point really meant a lot. And I don't think he was able to keep 31 for the Suns at this point, but just a way to like honor. And every time I watch a game now, you know, I know that like he's kind of playing for me is how he put it. But yeah, as a family, like hard times really just bring you together, especially something like this. So I can't imagine what that was like for you, Juliet. So like just that duration of CPR. Like I just recently got recertified in CPR. So the whole thing about the sternum, like, you know, has is very strong and so is your family. But yeah, it definitely just brings families together.
Yeah. You all both have pretty amazing outlooks. I mean, I've obviously, I've met a lot of people that have gone through similar things that you all have, and it's not, it's a process for everybody, but you all are both like role models for what, sudden cardiac arrest survivors should aspire to be with just your general outlooks on life and kind of where you're at with everything. So I kind of want to talk about what you all are both doing now, but before we do that, I want to kind of, I want you all to give some advice. So like if you got a phone call today from somebody that just survived a sudden cardiac arrest, woke up in the hospital, talk through everything with their doctor, and they're kind of going through that like transition in life now to figure out like what's next. Um, Starting with you, Julietta, what advice would you give a sudden cardiac arrest survivor that kind of is just going through everything?
I would say to, well, I would say my biggest regret was looking to make things like my life go back to the way that it was before my cardiac arrest when that was no longer attainable. So I spent so much time worrying about, can I play volleyball again? Will I go back to the same school that I was in? Like all these things that changed after my cardiac arrest, I was so caught up in trying to make my life look like that when in reality that was not feasible. Like it was there, like my family and I like to joke that there's like pre-cardiac arrest me and after cardiac arrest. So because everything just changes. So I would say to give yourself some grace and time to rediscover what your new life will look like after cardiac arrest, which doesn't have to be a bad thing. But I just think reminiscing and comparison will be the biggest thief, at least for me it was in my recovery, comparing myself to how I was then, what I looked like then without my scar, all that stuff. Like it's being unnecessarily harsh on yourself after going through this very difficult event. So I would say just try to like take some time to rediscover what your life will look like and just kind of come to terms that like it's okay for it to be vastly different than it was before. That doesn't mean that it's any less great and that each day is worth any less than it was before.
Great. Yeah. Kai?
Yeah, I think I'll start off just with a similar point. You know, that whole comparison thing was huge for me. Like there's not going to be many people you can compare yourself to anymore, and that takes some acceptance. Um, Another big thing will just be build that social support, like really take pride in that and take pride in the people that you surround yourself with, because that's going to make it 10 times better, just your overall experience. You know, don't don't try to essentially set yourself on fire, like to keep others warm. Like if you're having a hard time with what you're going through, don't feel like you have to conceal it or have this outlook that I can handle it like all by myself, just to like make other people around me maybe feel better about the whole situation. Like it's a hard thing that you just experience. So I mean, it's bigger than a hard thing. Like it's hard to even put into words, but really try to embolden yourself through others that you trust and also respect and you feel like are worth your company and vice versa. Yeah, but I think that first point about comparison is huge. Like I think that was a barrier I kept running into, was because my thing was not only comparing myself to like past me, but was comparing like myself to other people that were like getting offers and playing college basketball and all that stuff. And so that was something that internally I just had to eventually get over, through just kind of focusing on every day, just one day at a time. That's another thing that you kind of hear growing up, like just live your life one day at a time. But in this moment, like that really is something that's going to be beneficial. Like just actually take one step at a time, 1 hour, one day at a time. and don't try to get too lost in the grand scheme of things.
Yeah. Wow. That's awesome. All right. So I kind of want to give each of you a chance to kind of talk about kind of what you're up to now. And maybe maybe what your hopes are for the future as well. So Julietta, kind of if you could give everybody an update on where you are, what you're studying and everything.
Yeah, of course. So now I'm a freshman at the University of Texas at Austin, and I'm studying neuroscience, hopefully going into medicine, which is kind of redundant, but I'm very happy now. I no longer play sports, but I love to weightlift. And as far as stuff goes with my cardiac arrest, my sister and I, right after my cardiac arrest occurred, made our own organization called Surviving NCA. And I would also like to point that out. That was a big piece in my recovery as well, like trying to give back and actively know that I'm doing something to better the chances of other people surviving and having the second chance that I got. So um through Surviving CA, that's where I met you, Mike, and now I got to meet Kai, who's wonderful. So it's just such a good way to meet like a good community of people that have also that can relate to what you're going through. But yeah, no, I would say that I'm doing much, much better, and I'm just very happy and overjoyed with life. So it does get better.
Yeah. Cool. And Kai?
Yeah, that's amazing. So after my sudden cardiac arrest, I did my undergrad at Butler. I majored in psychology, minored in Spanish, was a manager for the Butler men's basketball team, and then was a grad assistant for 1 year because I did my undergrad in 3 years, so I had an extra year to where I could obtain a certification in strategic communication while I was at Butler. Learned a lot there, had an amazing time. And so now, in terms of like current steps and what I'm doing for my future. Currently a first year master's student at the University of Illinois Chicago, studying sports, exercise, and performance psychology. I plan on becoming a sports psychologist, so kind of just aligning myself in the position to where I can work with D1 through D3 athletes. Athletes that are coming back from injury, overall, just helping athletes navigate this monster that college, sports is. So I do plan on continuing my education and getting my PsyD in a related healthcare field, and having an emphasis in sport in that related healthcare field. So yeah, just similar to Julietta, like every day, really am overjoyed with life and feel great. Like most days, I don't really have bad days at this point because I know kind of what I came from. So yeah, just really excited to be doing the work I'm doing right now, and currently working with a team at UIC, and more so in an observation role, but we'll be stepping into a little bit more of a command over the information when working with athletes in one-on-one sessions, which is just so great for me because I really think I'll enjoy that field of work, and it won't really feel like work to me. It'll just feel like a purpose that I'm kind of fulfilling.
That's awesome. And you're doing some work with Simon's Heart as well, in Philadelphia and some around some of the great work that they're doing, which is awesome. All right, so a couple questions that came in. First one, just I know you both talked about exercise, and this is a good question because I think it comes up a lot. I think like for a lot of like heart disease patients, cardiac arrest survivors, obviously exercise, no one's ever going to debate that exercise is not healthy. So exercise is very important, maybe more important for someone that has something wrong with their heart. But obviously there's a piece of it where there's some fear that comes with it, and like trying to navigate that whole like, how hard can I push myself? So do you all have anything that you can offer advice wise on like exercising? And is there anything you use to like measure how hard you're going? Is it a feeling? Or just kind of talk through kind of like what your exercise routines look like. And I know everybody's different, but I think it'd be helpful, for this question to just kind of talk through that. I think that'd be helpful for other people that are in similar situations. So, Julietta.
I would say for me to be able to exercise and be confident that I am like not harming my heart or putting myself in danger of going into cardiac arrest again. One of the big things that I use is my Apple Watch. I know it's not feasible for everybody, but it has helped me a lot to keep track of my heart rate and make sure that I'm staying within that range that my doctor kind of told me to. So
Mhm.
that way I can continuously monitor where I am at in my routine and know if can step it up or slow it down and stuff like that. But I would say for the most part, before I even had like a device actively monitoring my heart rate for me, I would just say like intuitively to take it slow, like slower than you think you should. Because even though exercise is beneficial, in our case, it can also put you in a little bit more at risk if not done properly and with caution. So just getting to a little more familiar with your body and how your heart responds to exercise after a cardiac arrest, I think will give you a good idea of where to go from there. But I would say for me, my saving grace has been just weightlifting, which I really enjoy. And it's a good mix between me being able to like speed up my heart rate a little bit, but not so much to where I am in constant fear that I am going to go into cardiac arrest or my pacemaker has to kick in or anything like that. So that is something that has been approved by my doctor and that I've really enjoyed throughout these past years and has let me stay active for now 3 years now. So yeah.
Cool. Kai?
Yeah, I think having something that monitors your heart rate is crucial, whether it's an Apple Watch or Fitbit. I think Fitbit might be a little less expensive. I think at one point I had a Fitbit, but now I have an Apple Watch. But yeah, definitely just being able to what's the word, like stagger your work and build on it, like start slow. I think you put it greatly, Julia, to like start slower than you want to, because obviously like if you're an athlete or somebody that was just an active person in general, like there's a certain level that you're used to and you can't start at that level. You have to go back a few steps. So just appreciating that, like just trying to fall in love with the process of getting to know your body. Like it was really cool for me to start like really learning my body and learning like I can do this and feel like this, and then if I add on this, this is what my heart will feel like, and that was crucial for me because I felt like I really became a lot more comfortable in my own skin. So really just taking it slowly, like trust what your doctor says, look up different videos with about things pertaining to your heart condition. Perhaps it might be out there on the internet as well. But just taking it slow, don't rush yourself, be patient with yourself, and just look for that beauty in the overall process of kind of regaining this ownership and efficacy over your own body.
Yeah. Cool. All right. And last question that came through was this. So, what's your treatment like now? Like, how often are you seeing your doctor? Do you have to take any medication? Have it, just kind of like what are you doing on a day-to-day basis or a yearly basis just to kind of treat, your heart condition? So, Julietta?
I am actively taking multiple beta blockers, so I just take mixolydian metoprolol.
Mhm.
I switched medications probably like over 30 times in the past couple of years, so it took a while to fine tune what worked for me and what worked for my heart and gave me the least side effects. But I would say that that medication has truly been a lifesaver and has allowed me to be able to live a healthy life. And as far as seeing my doctor, I have been moved up to only seeing her once a year. So truly, I think honestly, I forget most days that I even have a heart condition since I started this new medication. I don't have to be so constantly worried about it. But yeah, no, my treatment has definitely progressed and has elevated since I first started or since I first got out of my cardiac arrest. And as far as like mental health wise, I still go to a therapist that helps me just with like everyday stuff. If I felt like a heart rhythm that was wonky or I saw someone collapse or stuff like that, like they help me navigate through the ongoing struggle of recovering. So I think those three pieces are very crucial for me in my recovery so far.
Cool. Yeah. Kai?
Yeah, very similarly. I just take one metoprolol 50 milligram pill. I sometimes I do forget, like if I'm not like looking at myself uh like with my shirt off or something, like so I can see like the implant. I sometimes forget I even have a heart condition too. I only see my doctor once a year. I used to do twice a year, but also got bumped up to once a year. So just an overwhelming feeling of gratefulness and just like contentness. That's a word. Just
Mhm.
overall content. Just with like how things have turned out and like just my day to day like livelihood. It's great. So yeah, so it's pretty much just a pill a day, and then I see my doctor once a year.
That's awesome. Cool. All right. So that, we don't have any more questions. I just want to say thank you to both of you for really being open. I've felt like, and being a cardiac arrest survivor myself, I felt like there's like limited resources for people like us. Like we have these great doctors that help us, but it's harder to kind of find and hear from other people that have such a positive outlook on life and learn from them. So we're recording this, and I can tell you, I know for a fact that this recording is going to be a very, very valuable resource, and I'm going to like make sure it gets to people that can get it to other survivors, because I think you all spoke so well, and you're so you have such a positive outlook after everything you've both been through. So I am very confident that this is going to like get in the hands of other survivors and have a positive impact on them. So I truly appreciate you doing this. And I'll also say, just for everybody watching this, you all are both very humble when talking about the level of athlete that you were, because we're not talking about just like, like someone that grows up and, gets to play some sports in high school. You guys are both very, very high level athletes. And, just blown away by, how well spoken you both are and how awesome you did kind of talking about life after sudden cardiac arrest is really cool. So thank you both. So just so everybody knows, we are, like I said, we're recording this, we're going to edit it, we're going to get it up on our YouTube channel. And if you know a sudden cardiac arrest survivor that this can help, please share the link once we get it out, because we need more resources like this out there. So thank you again both for being here.
Thank you for having us.
Yeah. Have a great day, everybody. Thanks for joining.